Welcome to Allergy and Asthma Network's Patient Learning Pathways series. Today's program will look at managing medical therapy and living with Aspirin Exacerbated Respiratory Disease, or AERD. Aspirin Exacerbated Respiratory Disease, also called Samter's Triad, is a medical condition that consists of three clinical features: asthma, sinus disease with recurrent nasal polyps, and a sensitivity to aspirin and other non-steroidal anti-inflammatory drugs, or NSAIDs. The goal of AERD management and treatment is twofold: to prevent reactions and to manage asthma symptoms. People with AERD need to avoid aspirin and all other NSAIDs to prevent reactions. Acetaminophen can be used as an alternative to treat body aches, colds, and fevers. Many people find that acetaminophen is usually safely tolerated at low doses. People may continue to have symptoms of asthma, nasal congestion, and polyps even if they avoid NSAIDs. Most people will need to use daily medications to control their AERD symptoms, including inhaled corticosteroids for asthma, intranasal steroid sprays, or steroid sinus rinses to help control nasal symptoms, and corticosteroid injections to treat nasal polyps. Biologic medications may be of benefit. These include mepolizumab, omalizumab, dupilumab, reslizumab, and benralizumab. Biologics are approved for treatment of severe asthma. Some are also approved to treat nasal polyps. Biologics are not currently approved to treat AERD. Several non-steroid medications may be of benefit. First, Xyleutin inhibits the production of leukotrienes, and montelukast and zofirlukast block the functions of leukotrienes. People with AERD often need to have surgical removal of nasal polyps. Unfortunately, it's common for nasal polyps to return after surgery. Aspirin desensitization, or long-term daily aspirin therapy, is also a treatment for some AERD patients. Desensitization consists of administering gradually increasing doses of aspirin. The goal of aspirin desensitization is to allow patients to safely take aspirin every day as therapy. Daily aspirin therapy decreases the regrowth of nasal polyps and reduces the need for corticosteroid medication. An added benefit of desensitization is that it allows patients to tolerate aspirin and NSAIDs again. Aspirin desensitization should only be performed under the guidance of a physician in a hospital or clinic that specializes in this treatment. Other presentations in our Patient Learning Pathways series will describe AERD in more detail. They will also provide guidance on diagnosing the disease. Join us for another Patient Learning Pathways presentation. Allergy and Asthma Network is working every day to end the needless death and suffering due to asthma, allergies, and related conditions. We do this through outreach, education, advocacy, and research.